hello there. Make yourself comfortable. I'm Dr. Sarah and I'm going to be administering your Botox treatment today. How are you feeling today? Good, good. I'm just going to bring up your details. Okay, so we had a brief consultation before, didn't we? Yeah. And you're still happy for the procedure to go ahead? Good, okay. So, I can see that we discussed the brow area, okay, and the 11s, the frown lines there, okay, just up there. And also you've got a couple of areas of crow's feet that you wanted to have relaxed. Is that still the case? Okay, that's fine. Well, what I'll do, I will firstly have a closer look at your skin today. Make sure everything's okay, that you've got no lesions or anything in the areas where I'm going to be injecting the Botox, okay? Yeah, I mean, we wouldn't be injecting into areas where you've got sort of acne lesions or anything like that. Okay, but I don't think you have because your skin looks really clear. Good, okay. Firstly, I shall get some gloves on. So you're excited about this? Yeah? Good. Okay. So firstly, I've just got some nice whites. And I'm just going to cleanse the area. Okay. All right, lovely. Can you just close your eyes for me? Thank you. And just cross the forehead there. Alright. And just round the sides. Okay, that's great. Okay. Alright, so I'm just going to have a look around. Make sure that skin is okay. I think it is. Let's have a look. Yep. Okay, that's looking fine. Okay. Okay, so nothing felt sore or tender around there. I certainly can't see any active lesions there, so that's good. Good, great, okay. Okay, next thing, I've got a special pen and I just need to mark out the areas that I'm going to inject. So I just need you to do a few little facial expressions for me. Okay, the expressions obviously accentuate where those lines form. Okay. All right, so first thing, I want you to give me a nice big frown, please. Yeah, good frown. All right then, okay. That's fine. Up there. Okay. And frown again for me. Okay. Great, okay. Just roll that there. And, okay, and can you just raise your eyebrows for me? Okay. Okay, and again. Okay. And can you do me a nice big smile? Okay, just come around this side. Okay, and smile again for me. Okay. Okay, so just perform those movements for me again now. Okay, so raise your eyebrows. Okay, and frown. All right, and smile. Okay, that's great. Okay. Right, so the next thing I need to do is to apply a special anaesthetic cream to your skin. It's a special cream that we've had formulated for us, for our clinic, and it's very fast acting, and it numbs up the area really well, because we're not into the habit of hurting our patients, as we want you to come back and have more Botox. Okay, so this is the cream. Okay, so let's just dispense some of that on there. Okay, and we don't need an awful lot, so I'm just going to start applying that. Okay, across the forehead. Okay, and just a little bit more on there. And then up. Okay, I'm just going to sweep up there. Okay. Want to make sure all the areas where I'll be injecting are covered. Okay. And then just round the side for that little crow's feet area. Okay, and here. Right. And then just a little bit more up and down. Okay. There. That's fine. That's great. Okay. So that's going to take just a few minutes to start taking effect. You should start feeling a cool sensation. Yeah, that's good. Okay. I'm just updating this while that's taking effect. Your medication is still the same, isn't it? Because I only spoke to you recently, but yeah, that's fine. Okay. Okay, that's good. Now, I know we've already spoken about this, but you asked me before how long this would take to become effective once it's injected. It varies from person to person, but it normally takes 3 to 5 days, maybe a little bit longer for some people. Okay, so at first when I've injected, you will get some little bumps, okay, and then you will start to see over the next several days the lines smoothing out. The expression obviously will not be so pronounced as those muscles are relaxed, okay, and the muscles can't function the same as they could before the Botox was injected. Okay, so when you do that on your forehead, those lines won't be visible. Okay. Side effects wise, not everybody gets a side effect, but the most common reported is headache. It's not normally a severe headache, it's just you just feel a little bit achy and tired maybe. And also, as the Botox starts to take effect over the course of the few days after the treatment, you may start to feel like a heaviness, because your brain is thinking, why can't I move these muscles the same? And it does in some people cause a sensation of heaviness in the forehead and around the eyes. It's not so much of a discomfort, it's just sometimes people find it a little bit unusual, and that soon wears off when you adjust to it. Okay. Obviously, if you were to start feeling unwell in any way, you need to contact us straight away. Okay, but that is a very, very rare occurrence, and we wouldn't envisage that happening. Okay, given your history, you know, you're very, very well. You don't suffer from any allergies. I don't think we're going to have any problems there. Okay, so how's that feeling now? Is it starting to numb up? Okay, let me just have a little press on it for you. Okay. All right. Can you feel me touching you? No? Can you feel that? No? Can you feel this? No? Okay. I think we're good to go. So if you relax, I'll just get everything ready. Okay? Great. Okay. So what I need to do first is remove the cream, grab a special solution, and this just allows me to wipe off the anaesthetic cream. Okay. It does smell lovely, doesn't it? There we go. Okay. So, the pen that I used is still visible, so don't worry, I've not wiped it off. It's especially formulated to not remove the marking pen. Okay, that's good. Let's look at that now. Super. Okay, so we're nice and numb, aren't we? Yeah. Great. Okay. So, what I need you to do is just relax there for me. The first injections I'm going to do are here for your 11s. Okay. So, you'll just maybe feel a little bit of pressure, but you won't feel any pain. Okay. So just relax for me. Alright, okay. Alrighty, and there we go. There's one. Okay, and there's two. Okay. And there's another. Okay, and okay. And now I'm just going to do your forehead. Are you okay there? Is it painful at all? That's great. Okay. Alright then. Just keep nice and still for me. And just in there. In there. Okay. And I'm just going to go in there. Okay. And in there. All right. Okay, just have have a look there. So just raise your eyebrows for me and frown. Great. There's just two more at the top I want to do. Okay. Right. And there. Okay. And I'm just going to come round and do the crow's feet area. Just turn your head slightly to your left. Okay. Slightly. Alright then. And you might feel a little pinch here. Shouldn't do, but it is slightly more uncomfortable than the forehead. Okay. That's great. Well done. And another. Okay, super. And just round this side. Okay. Okay, and just one more there. Okay. Okay. So let's have a look at that now. That's great. So you can just smile for me. That's great. And can you raise your eyebrows and give me a frown? That's good. Okay, so I want you just to relax there for a little while. Okay. Right. Okay. Just got to make a note of something there for later. That's super. Okay then. You okay? Good. That's looking fine now. You got any further questions for me? Okay, right. It should last up to 3 months, okay? And then we'd actually recommend that you come back really just before you start noticing too much of a recurrence of the lines and expression lines, because if you want to keep on top of it as a preventative measure, you really don't want them coming back too much, okay? So if you start to notice maybe your foundation is starting to settle in lines again, then's a good time to come back, okay, before it gets too prominent. Yeah, so it might be, you know, just under 3 months. If it doesn't seem to be coming back that quickly, you can perhaps leave it a little bit longer, okay? But what we'll do, we'll have you back in 2 weeks' time for a little top-up. We prefer to do that, okay? So we'll let this first treatment get to work, and then a couple of weeks have you back and just do a little bit more. Okay, just a tiny top-up. Okay, you'll see that was included in your quote. Yeah. Okay. So, just remove my gloves. Aftercare for the rest of today. Recommend you don't do any exercise, okay? We don't want you sweating, okay? We don't want you getting into a gym and working out and building up a sweat, okay? That's not ideal. Don't wear anything that's going to cover the areas that we've injected, like no hats or scarves, anything like that that's going to cover up the areas, all right? You can apply makeup, but if you can avoid it, do so, all right? And the other thing is try not to lie down for at least 4 hours. Okay, the treatment starts to work far better if you're upright rather than you lying down. So just for 4 hours. Yeah? Okay. And if you do start to develop a headache, obviously just take a mild painkiller like paracetamol. It shouldn't be such a bad headache, but if you do start to feel unwell in any way, as I said earlier, do give us a call. Yeah. So what I'll do now, I'll just get you your 2-week top-up appointment booked. Okay. Let's see. So could you come back 2 weeks today at 10:30 a.m? Great, okay, that's fine. All right, that's great. And are you going to pay by card today? Yeah, okay. Well, if you pay at reception on your way out, yeah, that's fine. We accept that, that's no problem. They will deal with all that for you and give you a receipt. Okay, and they've also got some leaflets out there as well about your aftercare. I'll hand you one of those when you've settled your bill. Okay, so at the moment you've got these little bumps, but they will subside in the next several hours, okay? And that's just obviously where I've injected. All right, so I look forward to seeing you in 2 weeks' time and seeing how things are going. Okay, like I said, everyone's a little bit different, so if you've not seen any results within, say, 3 to 5 days, don't panic, because sometimes it takes a little bit longer, up to 7 days or so for some people. It may be that you start to see results within 2 to 3 days. Yeah, but we'll make a note of how quick it's worked for you. When we see you next time, if you just make a note of it for us and let us know when we see you. Okay then, well, enjoy the rest of your day. Take care. Don't rush around. Don't get too hot. And try and avoid that lying down for at least 4 hours, yeah? All right then. It's been lovely to see you today. Take care and I'll see you in 2 weeks. Bye-bye.